Awesome. All right. Mr. Black. Mr. Black, can I go to the bathroom? Please. Would you raise one or two there?
Chuck. How are you?
Well, yeah, but I want to. Right. As good as my eventual one day on the rest, he would whip everybody. I told him it's complete bullshit.
Linwood, are you headed Linwood? Yep. So it's, I've got a 9 o'clock. Does that start?
They'll start at 9.
It'll start at 9?
Yeah, I haven't emailed them yet, but they usually start at 9.
Okay. Do you need me for weigh-ins?
You can't even get in my Arbiter account right now, so I don't even know. Is it this weekend?
No. It's
2 weekends. Yeah. No, just the weigh-in official on that one. I'll email you.
All right. Thank you all for finding your way to the new location. Hopefully this will work out for us. It is significantly cheaper than the JCC had become, so not as convenient, I realize, but oh well.
What about the prestige factor being on Mercer Island? That should be
You're in the Highlands and Issaquah, everybody costs $1 million.
Here's the trade-off I didn't put in the email. Next time we can have pepperoni pizza here.
Would you like me to bring the pepperoni pizza? Even I submitted last film.
All right, first on the agenda, we have a guest speaker, Dr. Howe, all the way down from Bellingham, who is here to talk to us about skin conditions, identifying them, and what we need to know. So we're going to just,
Let me say this.
Yeah, introduce him.
Yeah, go ahead.
Go ahead, no, you go ahead.
Well, I'm just gonna say, I guess it was this month, where Dr. Howe received a prestigious award from the State Wrestling Association. He's also a Babbitt Award winner, and when it comes to sports medicine, this man pretty much wrote the book, particularly for Washington State and particularly for wrestling. So we're very honored to have you here, Dr. Howe. Thank you so
It's it's always good to, I can handle this, yeah. You can see better from back there. I think that officials are the obvious backbone of the sport, and it's always a real pleasure to get a chance to meet up with you and to talk with you. What we're going to talk about is infection control on the mat tonight. It's a subject that kind of gets thrown into your lap because it's very seldom in matches that you are at, very seldom a designated physician to decide on skin things, and so it's up to you. And that's good fun. Let's see how I get to make this move here. Just a second.
Hey, Dr. Howe, you need a quick second? There was something I wanted to say to the group.
Go.
I think you might have touched on this, but just a little history. Dr. Howe joins us this afternoon from a long drive from Bellingham, Washington. Out of the kindness of his heart, also the passion for the sport, to help give us insight on how to manage and handle skin conditions and help keep the kids safe. Dr. Howe went to high school in Long Island, to a school that didn't have wrestling, so he played basketball. We won't hold that against him.
Not very well.
But serving his medical residency in upstate New York, he found himself involved in a Cornell College match, wrestling match, and they needed a physician on site. He was on one for it, and the seed was set. He worked his medical practice in Oak Harbor. He became deeply involved in volunteering as a team physician for the Oak Harbor High School, and he worked heavily with the wrestling program and built a great relationship with coach and biology teacher Ryan Litzenmeyer.
Rich Litzenmeyer. Some of you may remember Rich.
In 1975, they instituted the nation's first minimum wrestling weight using skin fold and other criteria to help keep wrestlers safe, keep them from losing too much weight. So in 1975, that was a really predecessor from what we deal with now with weight losses, or with weight, keeping kids safe with their weight loss. He practiced medicine, served Oak Harbor athletes for 21 years from 1971 to 1992. Then he moved his practice to Bellingham and worked with Western University as a team physician. As you know, Western doesn't have a wrestling program, so with no wrestling at his university, Dr. Howe continued his involvement with the sport, with the local sports teams and with the wrestling teams, serving Matt Classic as their initial medical director in 1988, and serving as a medical director at Matt Classic from 1988 to 2007. 2011 he retired. However, he is still actively involved in the sport, and we appreciate his volunteering today. Like us officials, Dr. Howe serves as an official role himself. He's a member, currently he's a member of the Washington State's Medical Quality Assurance Commission. This board is responsible for issuing medical licenses and disciplining physicians when they step out of line. Thank you for stepping in there, Paul, but let's welcome, he's out of here, he's volunteering to be here to help us with our program, help us to make the important decisions we need to make. So thank you again, Dr. Howe.
I'm impressed that you all take the time to meet like this and to make yourselves better at what you do, so that's good. I think that you officials have probably the most difficult officiating job in sports. Not only do you have to deal with the rules and such, but you have that awesome responsibility of keeping two wrestlers who are dead set on winning a match from harm, and that's good. Maintaining the avoidance of infection is part of that, and so that's real important. So let's try to get you through some of the things that happen with skin infections. I just want to go over a couple of the rules to put what you do in perspective. It's important to know that on matters of judgment, the referee has full control of the match. The referee's decisions are final. That's not just any referee who happens to be there. It's the referee who's designated to deal with that match or with that tournament or what have you. If something's not specifically covered in the Federation rules, the referee has the authority to interpret those rules and to make decisions. That will be important as we talk about this later. Anything that is not covered in the rules, the referee makes it up as he goes along. So the referee is in charge. The referee can rule on any situation that's not covered in the rules, and the referee's decision is final. We were having dinner tonight, and we were talking about things that have happened in the past, and a referee was telling me that they made a decision that a person couldn't participate because of a skin problem. And then another referee happened on the scene and said, "Oh yeah, I'm not covering this match, but I'd let him wrestle." And so the person went ahead and wrestled. Well, that's wrong. The referee who's designated for the match is the one who's in charge. And don't ever forget it. Okay, the next rule, the referee is required to either perform skin checks or verify that skin checks have been performed by a designated on-site meet appropriate healthcare professional. And we need to talk just a little bit about who those people are. This mandates that the referee perform the skin check. They have to be done by a designated qualified healthcare professional. What's a designated professional? It's somebody that the management of the match or the tournament says is the person who is going to make those decisions. It's amazing how when you as the referee make a decision, the parent who just happens to be a nurse practitioner or a physician or something comes running out of the stands and says, "No, that's perfectly all right. He can wrestle." that's not legitimate. That is not the designated person. The person, the healthcare authority has to be designated in advance. So there's none of this shopping around for whatever opinion you need to find. A qualified healthcare professional is one who the WIAA says is allowed to perform pre-participation qualifying physical examinations, and that is anybody who's licensed in the state of Washington to do that. So, physicians, osteopathic or allopathic physicians, are authorized to do that. Registered nurse practitioners are authorized. Physicians' assistants, if they are related to a physician who is authorized to do physical examinations, can perform physical examinations. There are some people who can't perform those physical examinations, and the big exception is chiropractors. Chiropractors are not on the list of people who are authorized to do physical exams, nor are medical assistants, or EMTs, or paramedics. And so if one of those people decides they're going to tell you whether or not this skin lesion is okay, no, they can't do it. Any questions about that? A skin lesion, if in the decision of the referee it's contagious, it can be the sole reason for disqualifying a wrestler for participation in that match. The wrestler or the coach can present a form. You've all seen the form, and they can present that form, and the referee can take it into account. The referee does not have to accept that form as being gospel. Certainly at the state tournament we get a lot of forms, not all of which we accept. If you don't think that that form adequately reflects the situation, you don't have to accept it. We'll go into that a little bit more here. But the rules don't specifically say that the form can be overruled by the referee. My interpretation, though, of the rules, they're that cloudiness as to what the referee's authority is. My take on it is that the referee, being responsible for the skin health of the wrestlers, in the absence of that designated on-site healthcare professional, can overrule a form. Here's the form. You've all seen this, I think. A little bit of trivia. This form started out, we wrote this form in Washington in 1999, and the National Federation adopted it with a few changes in 2014 or 15, something like that. Okay, so when you get this form, what you need to do is you need to check to see that the dates are valid, that it's been reasonably contemporary, and that the dates that the person who certifies the form says will indicate when the wrestler is ready to compete. Those dates are appropriate. Then you need to look at what the description of the lesions is, and that's where this really nice diagram comes in. Because the diagram should be filled out with contrasting color indication of the lesions. Make sure that the description of the lesions matches what you see on the wrestler. Comes in with a form and he says, I got this thing on my back that I can wrestle, and so I should be able to wrestle, except that I got this thing on my face too. And so make sure that the form and the wrestler match. Down here, they have some words about treatment, and they're very, very vague. Tell you a few days of treatment for this and a few days of treatment for that. You're not expected to figure out whether they're on the right drug or what have you, but it is a good idea to look and see whether there's been the minimum treatment that the physician or whoever filled out the form prescribes, if that has been carried out prior to the time of the match. So that, for instance, fungus takes about 2 or 3 days of treatment. The usual skin infection, impetigo and such, takes 10 to 14 days of treatment, and herpes takes, again, about 2 weeks of treatment. And so you want to know that that duration has occurred. If the form looks okay, and if the wrestler and the form match, and if nothing goes off in your head, you can honor the form. And that is doing due diligence to protect the wrestlers. However, if the form doesn't look okay, if things just don't match, do not be afraid to say, no, I'm not going to accept this form. And there may be squawks from the coach and what have you, but you are also doing your due diligence by not honoring a suspicious form. Invariably, a wrestler is going to come in with a note that says, usually on a prescription, doctor's prescription pad, which says, okay to wrestle, and it's signed. That is not appropriate. It's got to have all this information on it, or else it doesn't count. So be sure that the informal notes just don't fly. The skin check is to detect infectious things that are on the skin that might be transmitted. Also, one of the things that I think is really important just to think about is that you might detect skin issues that might be of potential danger now or later to a wrestler. So we'll talk about that a little bit later when I show you some pictures. The official is not expected or even allowed to make a specific diagnosis. Your only decision to make is, can this person wrestle with this, or can this person not wrestle with this?
Dr. Al, quick
Yeah.
question, just from the form. It's always been, and it has the one line says, earliest date the wrestler may return to participation. So obviously that gives us a clear indication about, if today is one of those dates. But the line right before that asks, form expiration date for this lesion. Note on the diagram. So the form expiration date, so let's say the form indicates that the wrestler can compete, but now the expiration, but now the form is expired because it's sometime in the future. It just seems it seems like the argument could be made, well, he's been treated and he's obviously by the form able to return.
You picked up one of the defects of the form.
Yeah.
Yeah, I don't know why the National Federation put that expiration date in. The thing you really have to know is, when has treatment progressed far enough that the doctor would allow competition. So I would ignore that one.
Okay.
I don't think it makes any difference. There's another thing on that form, and it says that molluscum contagiosum can be treated by hyfurcation and curettage. That's an electric needle and curettage. And then the referee, the wrestler can participate with it covered right away. And that's a violation of the rules, because the rules say that you can't cover something that is communicable in order to allow participation. So forget that on the form. It's not correct. Now, if a person has something that is not communicable, and they want to cover it with some bandage, I don't have any problem with that. That's not trying to cover up something communicable to allow participation. But if it's communicable, the wrestler cannot put something on and say, now it's covered so I can participate. That doesn't work.
Dr. Howe?
Yes.
One other clarification point, which we run into a lot of times, and I just want to make sure that we're consistent, and that is the point where it says earliest date the wrestler may return to participation. We run into the coaches many times that they take that word may as in, it's okay to wrestle on that date. And that is not our take. Our take is what we see at that moment. And we try to explain to the coaches, I'm sorry, we can't talk about his treatment or anything like that. All we can say is, look at it right now. It looked communicable to me right now, even though the doctor says he may be able to wrestle, he or she may be able to wrestle. No, not today.
You're
So
exactly correct.
it's really important that we clarify that, because that is so many times the coaches will come to us and say, well, it says he may wrestle. May doesn't mean shall, it doesn't mean will, it just means is possible.
Yep.
So,
And the important thing to tell the coach at that point is, look, this form is advisory only. The form is to communicate to the people putting on the match or the tournament what has happened to this wrestler to get him up to this point. But it is not a get out of jail free card.
Is there a reason they went away from the checkbox on the form that used to say not communicable? Or communicable, yes, no, where if the doctor said
That's
no.
that's what was on our form, and I
Which
I
is
love
say,
that, because that means that the
the doctor
go
looked
back
at it and
in.
said, no, it's not communicable.
But they
right?
had to, most of the time, they had to go back in
Right.
after they'd done the treatment and say,
Exactly.
I am not communicable now.
yeah.
I like that.
I'm guessing it was probably a logistical economy thing, they didn't wanna make kids go back
They
to the
didn't want to
doctor
look,
multiple
they
times or
didn't want
something.
the national form to look much like our form. Is what it was all about. But here is that form you were
Yes,
talking about.
yes.
Yeah.
This is the one that I
It
drew
was
up
so
back
much
in
simpler.
75.
Yes.
And
Or-
black
or
and white, it's so
99.
easy.
And this is the one now. You know, it doesn't have the yes or no.
Right.
And we were trying to make it as plain as possible, that it was a definitive thing to say. Even with that form though, even if it said yes or no, the referee still has the responsibility to say, you know, it just doesn't look right, no. Any other questions? Those are great questions. Okay, moving right along. Let's look at some lesions. This is ringworm. These are solitary ringworm lesions. This is what ringworm usually looks like. Basically, it's got an area of raised edge, which is kind of granular, a healing area in the middle, which is flat. You can see the same thing here, same thing here. This is very easily treatable with a whole host of topical things. And after you've treated it for 48 hours, it's not communicable anymore. The fungus is really hard to transmit to other people. And so, is that better?
Way better.
And so minimal, so minimal treatment is helpful. I'll tell you a dirty secret. I like to be very tough on ringworm early in the season. Because that tells the wrestler that, hey, if I got a skin thing, I'd better get it checked out. But if somebody shows up at the state tournament with something like this, they are not going to get disqualified. They've gotten that far, and this is a disease that doesn't kill people. Ringworm is easily treated, not a terribly serious problem. Yes, it's contagious. It will be taken care of. But early in the season, it's a great way to get a kid's attention to skin.
What would you be looking at to confirm that that obviously it's ringworm, but consistent with the note that it's not contagious? What would you be looking for? Kind of a hardened surface, certainly not weepy?
Time that it's been treated. Time, if it's been treated for, you know, it won't change. The appearance of it won't change in 2 or 3 days. But the fungus is so sensitive to these drugs that its communicability goes away just with a couple days. Yeah.
Isn't what we did in the 70s take care of so much of this, is the shower before the match, shower after the match, and the cleanliness of wrestlers that we're not getting right now? Isn't that, I'm not gonna say 100% cure or something that can help alleviate or prevention for that, but isn't that one of the big problems that is going on with any of these, is that if we had kids showering before, showering after, that we have this cut down to not zero, but pretty close to that?
Yeah, I think that's very important, and I'm glad you brought up showering before and after. All of the push is on showering after, and in many schools, they don't even have showers available, which is kind of crazy to me. But showering before is as, or perhaps more important than showering after. So getting this stuff off the skin is important. Regular cleaning of the gear is important. Regular cleaning of the mat before and after practice or a match is important. Yeah, these surfaces and the skin needs to be properly maintained. Good point. Yes?
Quick question. So with ringworm, is there any opportunity for ringworm to change into something more egregious, where that fungus that we're talking about with ringworm turns into a bacteria, or a bacteria infects the ringworm such that it does become a staph or impetigo or MRSA?
You guys are very, very bright. This is good. Anytime you have a break in the skin, something else can happen. So yeah, that's exactly correct. If you didn't hear, is it possible for ringworm to then be infected with something else? Absolutely, it can be. And then you just base your decision on what it looks like. Not having to make a diagnosis. Remember, we don't have to make a diagnosis.
Dr. Howe, can you go back to the previous slide, please, for a moment? So, if I was to observe this on a wrestler, and he did not have a form, the kid's not wrestling, period.
Sounds good to me.
Okay? Now, if he said, if the coach then says, well, it's been treated for 48 hours.
Does he have a form that says that?
Exactly, okay, because again, now we're relying on the truthfulness, of a contestant and a coach, which which we, they may very well be telling the truth, but if there's no form, and we have something that looks like that, the kid's not participating.
Right, remember what Ronald Reagan said, trust but verify.
Yeah.
We don't mistrust any of our wrestlers, but that form is something they've got to have.
So, again, and I'm sorry to stay on it, but so with ringworm, no matter what stage it is in, if we recognize it as ringworm, and there is not a form that says it has been treated for 48 hours, or treatment started on X date, and then that date is, was 2 days ago, and then it says that the wrestler may be eligible to participate in tonight's match based upon the treatment, then obviously we're okay. But if it doesn't fall within the parameters of those dates, then we're still going to tell that kid, sorry, you can't go.
I think that's exactly correct. Now, as I said earlier, when you get on to regionals for the year, and this kid has been wrestling right along and shows up with something like that, and you know that this is not going to kill. Well, I might develop a little bit of selective blindness at that point, but you would not be badly criticized for saying no, you're out. But at regionals, usually you wind up having a physician there,
Right.
and that gets you off the hook. Thank goodness. Yes.
You mentioned that if you have a form that shows you it's been treated for 1 week or 2 weeks, it should be fine. That's assuming the wrestler was compliant with the prescription from the doctor. The challenge is a lot of kids are not compliant. So then the burden comes back to us whether we let something that looks like any of the three of these go with or without a letter that shows there's been treatment done. However, after 2 weeks, we still have a visible ringworm.
And you will have whether it's treated or not. That's the big problem with ringworm, is that it doesn't change much over the course of the first 2, 3, 4 weeks of treatment. You pretty much have to accept the form and say, okay, you've treated this for 3 days, I'm going to let you wrestle.
Specifically related to that form, there's a return to participation place, right? It's my understanding that in years past, doctors would have to sign that form on a date saying that they could return to participation or expected return to participation, but that signature on the bottom of the page had to be at some point after that date. Is that not fair, or?
Yeah.
Doctors aren't fortune tellers, right?
If the form asks for when is the date of the visit, you put that date in, and then it says when can the wrestler return, and if those two dates are the same, that doesn't make much sense, because there's got to be some treatment that's going to be directed at this thing in order to render it non-communicable.
So if he goes to the doctor that day and it's dated that day and he's up for a match that night.
He's not wrestling that night.
Right.
But it also says, like we said earlier, it says may. And that certainly is the decision on the referee, is that may. Yes, he may, as Chuck said, be eligible on that day, but if Chuck or one of us looks at it and said, he's not going, then he's not going.
Well,
Now,
part of the suspicion.
One of the things we'll find out here is ringworm is the one that can be the most difficult because the lesion sticks around and doesn't improve serially with treatment right away. So ringworm is tough from that standpoint. The other things that we're going to talk about are a lot easier to tell what stage they're at, and we'll see some pictures of that.
But just to sort of pick up and amplify on Dave's point over there, part of what would raise our suspicion or not look okay is that there isn't sufficient time that, oh, this is impetigo, you know, it's dated yesterday, it's impetigo and he's good to go tomorrow. Because like you've told us, he needs to be treated for like 2 weeks. So those kind of things can be triggers for us to say, sorry, this doesn't look right because not enough time has passed or you didn't do the treatment yet. You know, you just got this today and it says you got, you know, you should have been treating this for 3 days at least.
Exactly correct. Exactly correct. That's why I said look at the form, make sure the dates match with what should happen. And there's some little hints on the bottom of the form about duration of treatment. So you should look at that. Okay, let's continue. This is just some other ringworm. Ringworm can be very entertaining in what it looks like.
Smiley face there.
Smiley faces. Lots of little spots. Inflammatory. This ringworm may well, the question we just had, that may well be secondarily infected. And so watch out for that.
Now that last one, that bottom photo, I'd be really reluctant to let him wrestle, because that does look like it's a current infection to me.
Of course you would. Of course you would. That's a lot different, huh?
Yeah.
Okay. This is ringworm on the face, and I want to bring this up because we're going to come back to this more. This distribution, you see it right around the jawline here, and on the upper cheek. That's a very common sight for ringworm. Here it's not quite as pronounced, but same sort of a thing along the jawline. And the reason for that is because when wrestlers lock up for a takedown or to start out a match, that's the part of the skin that is crammed together and ground together, and that's why you see this. And we'll see this distribution in other skin things as well. So that's just another look at ringworm. This is a peculiar kind of a fungal infection called tinea versicolor, and it shows up as a diffuse bunch of these patches, and that's also contagious, but it's no worse than any other ringworm. In fact, this is very easily treated if you treat it with showering a couple of times with anti-dandruff shampoo all over, and it goes away. So it's a very fragile fungus, but it makes a very spectacular picture.
Selsun blue, yes.
Selsun blue works very well.
So the treatment of that makes it, even the appearance go away pretty quick.
Yeah, over 3 or 4 weeks.
Oh, wow.
You treat it for a couple days, and then it takes 3 or 4 weeks for the lesions to go away.
For the tinea versicolor, does that affect any specific skin tone more than another?
You can see it more in darker skinned individuals, because that skin doesn't, it loses its ability to tan. In fact, the scar, well, not scars, but the appearance of it can persist for weeks and weeks.
So the darker blotches on the photo on the left, yeah, those are just normal skin
Those are
tags
moles
or moles,
what
or,
have you.
yeah.
They may be something that we'll talk about later.
Mhm.
But those are not the tinea versicolor. The tinea versicolor are
Right,
the pale
is the
lesions here.
it's the non-pigmented areas or whatever, if you could say that.
And so as long as we see the tinea versicolor, we don't let them wrestle, as long as we can see it, or is it non-communicable after a few days?
It's non-communicable after 2 days of treatment. And the treatment can be just Selsun Blue shampoos once a day, with the shampoo covering the whole body. This is impetigo. Now we're getting into a more serious thing, because impetigo is caused by Staphylococcus or Streptococcus, and these are potentially lethal infections. That is, if they get into the bloodstream, they can kill an individual. So we worry about this a great deal. Typical impetigo has a honey-crusted look to it, and it looks kind of moist and a little bit of red around, maybe a little bit of red around here, and it just doesn't look nice. It doesn't look like it's comfortable. Notice the distribution here along the jaw and the upper cheek. Same distribution as that ringworm we saw before. Always look at those spots, and if you see any kind of a skin lesion that has that distribution to it, it's highly likely that it is a communicable disease. This is impetigo late in the course, still crusted, and still has that sort of a honey-like, honey-crusted appearance to it, and this is still contagious.
Would you count that as an open sore where it has a break in the scab?
Yes. Yes, that's definitely open. It looks wet. It looks gooey.
Is that clear liquid?
It's generally clear liquid. Yeah.
Is that behind the knee? Is that where that picture is? It's hard to know.
That's on an arm.
That's on the elbow, okay.
The arm, it's the antecubital fossa just above the elbow.
Could be any,
Very common around the mouth.
Yeah.
Very common. But this distribution is the one you want to watch in wrestlers. Okay, I'm trying to find the right button here. There we go. This is methicillin-resistant Staphylococcus infection. Staphylococcus is usually easily treated, but there's this bunch of staph that is resistant to the usual antibiotics that we use. Methicillin is the archetype of antibiotics that we use, and if it's resistant to that, it's a much more invasive organism, it's a much more difficult organism to get rid of, and it's a much more potentially dangerous organism. These are pictures of methicillin-resistant staph. You notice that it oozes, and there's quite a lot of inflammation around it. Oozes, quite a lot of inflammation around it. And here it's got just multiple sores which are obviously very inflamed. Hard to really say whether, is this impetigo or is this a staphylococcus skin disease? Well, actually, they're both the same. Impetigo can be caused by staph. But I don't think there's much question that any of these, with pus oozing out of them, you're not going to allow to wrestle.
The picture in the upper right, that the actual size of that is like the size of a dime?
Yeah, or a quarter or a half dollar.
Okay.
Yeah.
Okay, so it is pretty big. Okay.
Yeah. Yeah, same thing here. These are nasty. Nasty. You look at them and you say, ooh, that looks sore. And the wrestler is likely to say, yeah, it is.
Is it?
You just put the word not
That
next to
kind
the
of
word
looks like
name.
could be a zip. Those things kind of look the same.
We'll talk about that
Okay.
in a little while here, because that's a decision that you wind up having to deal with. The thing about this is, compared to a zit, is that these generally are pretty isolated. And they're not necessarily on the face, but they're on the arms and legs, whereas zits don't.
Yeah, that's exactly why I asked the question about what size it was, because to me, if that was a very small lesion, I would have said, well, maybe it's just a zit. Yeah.
Okay, here's some more skin abscesses that are in various stages of development. This is one that's just starting. See a little bitty whitehead right there, and surrounded by a halo of red. That's going to turn into an abscess eventually. Here are some that are in various stages of resolution. This heaped up border that looks pretty old, it's been around for a while. That's what a healing staphylococcal skin infection would look like. If that's been treated for at least 10, 12 days with an appropriate antibiotic. Appropriate antibiotics are Keflex, Septra, which is trimethoprim sulfa. Either of those two antibiotics are perfectly okay. If it's treated with just penicillin, not satisfactory. But if that's been treated for that long and it doesn't look particularly wet to you, this one has a little bit of wetness, but this one doesn't, they could wrestle. This one is not ready to wrestle. It looks wet there in the center of this abscess.
And would you still recommend, so again, picture in the upper right, assuming that it was treated for 12 to 14 days, and we're saying that it's in its final stages, would we still want to cover that? Or does it really not make any difference?
The wrestler, for comfort, might want to cover it, and that would not be a violation of the rules. If you're saying you're not contagious and I'm going to let you wrestle, and he wants to put a cover on it, that's okay.
Well, I'm suggesting that we would say, I want you to cover it. Or does it really not make any difference at that point?
It doesn't make any difference, and you don't want to get into the business of advising whether to cover something or not, because then they come back at you and say, well, you violated the rule.
Hold it. I think the cover in my situation, if I see that and that's healing, I know that almost all of these things end up with a lot of thinner skin. So if that's not on someone's back, that's covered by a uniform, I'm going to say cover it, just because I feel that anytime you get close to a scrape or abrasion or thinking, rub on the skin, that you're going to break that open. So I'm going to say cover it just for that part.
I think that's reasonable, providing you don't say, if you don't cover it, I'm not going to let you wrestle.
I've got one thing to add there. Based on the doctor's note, it says, once a lesion is not considered contagious, it may be covered to allow participation.
Okay.
And so I think under the rules that are here, that we can advise them to cover it in order to allow them to participate.
Yeah, you can say, you're going to be much more comfortable with that, or you're going to avoid further trouble with that if you cover it.
Avoid it breaking open and bleeding.
Exactly, I explain it that way, that's fine. But I don't want the wrestler to get the idea that you're allowing him to participate only if it's covered, because then somebody's going to look at the rule book and there's going to be a tete-a-tete about that. It's a subtle point.
So if they don't cover it or cover it and it bleeds, it's just standard blood time, right?
Standard blood time,
You run out of
exactly
5
right.
minutes and they're done.
Exactly right.
They should have covered it a lot better.
Okay, moving right along. This is skin infection that is not abscess, it's skin infection that's spreading under the skin itself. We call it cellulitis. There's examples of it, and this whole leg is cellulitis. This is less of a problem of contagion than it is a problem of a very sick wrestler. And I would not let this wrestler wrestle, but I would advise this wrestler that it would probably be a very good idea for you to see a physician right now. Because this can get into the subcutaneous tissue and develop what's called necrotizing fasciitis, which is a limb-losing and sometimes life-losing thing, or can develop septicemia, can be driven into the bloodstream and cause lots of problems. So this is a very, very serious problem. A wrestler with this is probably going to have fever, probably going to have swollen lymph nodes in the area, like if it's up down here on the arm, swollen lymph nodes in the axilla and such, and they're going to be pretty uncomfortable generally. They should definitely not wrestle with this. Their own health being at grave risk, less of a problem with contagion.
Right, if we see that, we just ask for the note, that it's not contagious.
Yeah, if you see that and it's red, it's tender, it's swollen, and it feels warm to the touch, not only would I not let them wrestle, but I would strongly suggest that they leave here and go to the doctor right now.
We're not medical professionals, so we're not gonna give medical advice.
Right.
No,
No, but I will add to this, I had the flesh-eating bacteria and I was 12 hours for losing my legs.
Yeah.
So I'm on his side with that. If you see that, you can suggest it, because it's a scary crap.
I have no problem. You don't have to make a diagnosis. You just have to say, look, that looks really worrisome to me, and I would suggest that you see a doctor right now without delay. Okay, here's the big bugaboo that we really are trying very hard to minimize. This is the bug that's, if anything is going to destroy our sport from a medical standpoint, it's herpes simplex. We have to do everything we can to keep this off the mat. This is a cold sore, and a cold sore is disqualifying. No ifs, ands, or buts about it. It is disqualifying. This is the same stage, but a little bit removed from where the cold sore is. This probably was inoculated from a cold sore. This is early herpes. You notice the little blisters and redness around it. Same thing here, blisters and redness. And these are absolutely disqualifying. No discussion.
These are characterized by clusters of those little
Exactly.
blisters, right?
Clusters of little blisters. The wrestler will tell you, if you ask them, that it started to itch a little bit before he got it, and now it's painful. The wrestler may have some systemic reaction to it, may have fever, may have some lymph nodes swollen in the vicinity, depending on how much of a reaction his body has mounted, and depending on whether this is his first dose of herpes or whether it's a recurrent herpes. I'll show you some pictures of recurrent herpes down the pike here, and it's different. Once you get herpes, it comes back in the same spot monotonously over and over again.
Gift that keeps on giving.
Yeah, this is a very common place for herpes, is right at the hairline. This is pretty obvious. I don't think there's anybody who'd let anybody that looks like that wrestle. This is almost resolved, but not quite. And it's at that same spot. Be very suspicious of anything that is right at the hairline like that, because that's often herpes.
Next 2 weeks. How can we tell when it's resolved?
Yeah. Well, I'm not sure you can, but all of the textbooks say that it needs to be not red anymore. It needs to be calmed down in terms of the inflammation. The crusting should be uniform. There should be no blisters whatsoever. There should be no new bumps that have developed in the last 48 hours. How you figure that out from the wrestler, I have no idea.
But it's not really our decision, right? They
No.
have a note or they don't have a note.
Exactly.
Yeah, but if you get something that's resolved and he doesn't have a note,
Then he should have a note.
Well,
But, I mean, if, the more that we try to diagnose this stuff ourselves, the bigger trouble we get in.
Well, like that picture on the right,
Well, I'm trying to
might not
get-
even raise suspicion.
Let's
I
take,
didn't even
What I'm
notice it,
pointing
right,
out is this
exactly.
guy goes, the doctor says you can return to participation in 10 days. He shows up 10 days later, the note says he's good to participate.
And he's
But
good.
you're looking at this and you go, I don't know yet if it's resolved. I don't know if you've taken the crap that the doctor says you're supposed to take, and that's what Paul's getting to potentially. And
Yeah.
that's what I wanted.
okay, and there is no definite answer. We don't know whether this continues to shed virus on a continuous basis, really. But what I can tell you is, if this kid shows up with a form that says that 13 days ago, he started on appropriate treatment for herpes simplex, and it looks like that, I would allow him to wrestle. If he had because that's following the course of involuting herpes and doing what it's supposed to do. On the other hand, if this kid comes up and has no form, nothing indicating that he's had any treatment, I would not let him wrestle.
To be honest with you, if that kid showed up, I probably wouldn't even seen
On
that.
the right side. I have no idea.
That's true.
I wouldn't
No
have raised a suspicion at all on me if I looked at that.
No
It's
It's
like
all grounded in that.
red rubbing.
Yeah,
That's
so
one of the reasons why I'm showing you this is because I want you to be concerned about the hairline. Yeah.
So the one on the right, is it those bumps that look that scabbed over, or is that our
That's-
that we can look for? Is that what we can tell?
Yes, that's herpes.
Healing up of the.
That's herpes, and it's
Are those
very
raised?
late. It's very late. It's as I say, if he'd been on appropriate treatment, I'd let him wrestle.
Are those raised on the right?
No, those are pretty flat.
Okay.
They're pretty flat. They're no longer tender.
I would have never even seen it.
It looked like
Another wrestling.
Abrasion.
Yeah. I'm getting real itchy, Doc.
Are you?
My knees are scratching the tree.
Okay.
The note says he may come to
Just
the
a little.
meeting.
This is that lockup position. You all know what that looks like. You see how they grind their faces together. This is a very interesting thing. Somebody did a study where they looked at where the lesions were on wrestlers. And you find the vast majority of herpes lesions are on the face. Most on the right side, because most of them lock up like this with right side to right side. Some on the left side, because some lock up the other way. And very little of the herpes is on the torso. So if you look at face and around the shoulders, you're going to catch pretty much all the herpes. I don't worry much about a lesion that, if I look at it with my eyes just right, I'd say, well, that could be herpes, but it's on the arm. I really don't get terribly concerned about that. If it's obvious herpes on the arm, then I'll call it. But this is the area that you want to be concerned about.
Is that,
For herpes.
herpes simplex, is that anywhere other than just, we saw it was just around the mouth and forehead or on the head?
It can, head and shoulders predominantly.
Okay, and then what about herpes gladiatorium?
That's the same thing.
It is the same.
Herpes gladiatorum is just a nice name was given to herpes simplex
Oh, really?
to reflect that it comes from wrestling.
Gladiators.
Yeah.
People also talk about
I didn't catch it.
impetigo gladiatorum, and they talk about tinea gladiatorum, ringworm gladiatorum. It's just a way to recognize it's part of the wrestling spectrum. Okay. This is, here I used the term gladiatorum here just so you could see it. Is this distribution familiar to you all? Same thing, jaw, upper cheek, forehead. And this is classic distribution. It's amazing how often we see this in wrestlers. You notice that it looks wet. It's clusters of little vesicles, little blisters on a red base. You look at this and you say, that looks suspiciously like that impetigo that we saw earlier. A lot of doctors make that mistake too. If you think that, here, this will put lots of trust in that form. If you think that the doctors invariably know what they're diagnosing, forget it. They don't. We don't. We at the state tournament we have 6 doctors at the skin check, including 2 dermatologists. Okay, and the rule is that if we come up with lesions that we're concerned about, all 6 doctors will look at it, and then we'll all decide whether we will or will not let the wrestler wrestle. It's very seldom that we are uniform in the diagnosis that we give. It's very common, almost invariable, that we will be in complete agreement as to whether or not the wrestler should wrestle or not. And our rule is that if one of those 6 doctors says, I'd let the kid wrestle, the kid wrestles.
Only one of them has to say yes?
Now, only one has to say yes. At the state tournament level, we feel a real responsibility to not get in the way of wrestlers, providing we're being safe. And we think we're actually being safe at that point.
So we talked earlier on healthcare providers, dermatologists, they're not in that list.
Oh, they're used to
MDs.
Yeah, they're MDs. MDs or DOs.
Okay.
Yeah, they're okay. They're okay. But the only way you can really reliably determine whether this is impetigo or herpes in some situations is to do a culture and to see whether you could grow the virus. That takes about 5 days to get the result back, so it's not very helpful for the dual match you're doing right then, or the tournament. So culturing is out for these things, but that's the only way to reliably approaching 100% make the diagnosis.
We don't actually need to know exactly what it is. As long as if it makes us go,
You look at that, you're not likely to have the wrestler wrestle. Here's a couple of comparisons. This is early herpes. See that the redness, the little vesicles and such. This is late healing. This is not, it would not be ready to wrestle yet because there's still, if you look at it kind of cross-eyed, you see there may be some weeping there and a few things that look like bubbles there. But this is what it looks like as it's healing.
basically when it's healed, you're saying it's going to be not raised up anymore.
Exactly. It'll
Okay.
be flat. The crust will be all but gone. There'll be no moisture at all. There'll be no redness in this area, these areas between the spots. If it looks like it might be herpes, you have to consider that it is herpes and such. Couple of other comparisons. This is what we call primary herpes. This is the first infection, and the first infection is usually pretty dramatic. It's painful. A lot of skin reaction, lots of weeping. Lymph nodes in the area get swollen. The wrestler may have fever and is distinctly uncomfortable. Recurrent herpes, it's come back 3 or 4 times now, is a much milder looking thing. Look at the difference between those two. And yet it still has little bumps and a little bit of redness, and it's still in that nasty distribution that we've talked about. And you'd be worried about that one. Recurrent herpes is as contagious as primary herpes. It just does not cause this big reaction around it. Another look at primary versus recurrent. This is primary. Big blisters, inflammation, weeping and such. This is few little blisters, but not anything like the skin reaction that goes on with recurrent. but both are contagious. This is a nasty form of herpes. I put this up just to show you what can happen. This is a person who has gotten herpes started in acne, actually. Disregard the word eczema because they just call this eczema herpetica, widespread herpes. But it can also get into atopic dermatitis, allergy dermatitis, or it can get into acne. And this is a really difficult situation and can in fact become a life-threatening situation. It's unlikely you'll see this in a wrestler.
I don't care what the note says for that one.
Yeah, that one's
You're overruling it, Bob? Leave the room, please.
He would probably be in bed. He'd be really sick.
That brings up the one item though, when kids do have eczema, they have the sheet for that, non-contagious. You still need to look them over because they might have something that popped up as well.
Absolutely. The form is not a get-out-of-jail-free card. You have to compare the form with the wrestler you're seeing. And if the two match, that's fine. If they don't match, then your look is what takes precedence. Another form of herpes, it's not really herpes simplex, it's herpes zoster. And this is more common in people our age than it is in wrestlers, but I've seen it in wrestlers. It's the chickenpox virus, which you have chickenpox, it takes up residence in sensory nerves, and at some later date, about a third of the time, it pops out into a blister-like, inflammatory, painful rash along the path of that sensory nerve. Anybody who is over 55 or 60 should very definitely get the herpes zoster immunization. You don't want to get this because sometimes the pain can continue forever.
Is this also called shingles?
Shingles, exactly right.
Thank you.
Exactly right. So I just put that up there because it is a herpes-like virus. Molluscum contagiosum is a disease of young people, basically. It's little papules on the skin, little papules and blisters. And they have this unique little divot out of the top of them. And these are very contagious, can be spread easily. They're easily treated by taking an electric needle and buzzing each one and then scraping it down, and that eliminates it. But it's probably not immediately non-contagious as the note on the form would intimate. So if you see this, they can't wrestle, and they need to go get these things cleaned off, and then 48 hours later they can wrestle without any trouble. They should come back with a form about them. Not dangerous, it's not going to kill anybody, but it really freaks people out when they get this. Okay. There are two contagious skin problems that you probably will never see in your career as an official, but they're important, and if you suspect them, do something about it. One is head lice, and that's characterized mostly by the little eggs on the hair shafts. Sometimes you actually see a louse on the skin or on the hair shaft. That can be treated rather quickly by an appropriate shampoo, and the next day the person can wrestle. But they're very contagious. You notice that your kids probably have been sent home more than once from school with a note that somebody in the class had lice. Then there's scabies, also a very, very contagious disease. It's caused by a mite that gets in the skin, and the mite burrows through the skin. Here's the entry wound, here's the track, and here's where the mite winds up. And very, very often, you see it most predominantly in the web spaces of the fingers. Itches like the very dickens. Again, it can be treated very nicely with
Big crabs, guys.
Vodka, right?
it can be treated with medicines that kill the mites. Unfortunately, the itching doesn't go away for usually a couple weeks. And the reason that it itches so much is because the victim develops an allergy to the feces of the mite that's being excreted into the skin.
It's like having mice inside your
You probably never see these, I say, but it's these are skin conditions that are seen in people with wrestlers' age. You're gonna see a lot of this in wrestlers because they're of that age. This is acne. And in some cases, there's no doubt as to whether they can wrestle or not. No problem here, no problem here. Nothing that looks pretty awful here. There's scars and acne papules. Here's a little pustule, but I wouldn't disqualify that. Then you get into acne like this, which has got a lot of pustules, and boy, that is a tough decision to make. I'll give you a rule of thumb a little bit later, just as we get toward the end of the talk here. But that gets to be a difficult decision to make, and you would not be criticized for saying you can't wrestle, especially early in the season, because then he'll go to the doctor, or she'll go to the doctor, and she'll get appropriate treatment for acne, which is what's really needed here, and will relieve all the questions. But at the state tournament, wow, that would be difficult. This is a peculiar form of acne called acne conglobata, and it's just scarred, pitted, cystic acne, not at all contagious, but a real scarring problem for the poor victim. And you'll see this on the back of wrestlers with some frequency. Difficult decisions here. This is pus all over the face. I'd have difficulty having that person wrestle, and I'd be wondering whether there's secondary infection. What does this look like a little bit?
It's like herpes.
Herpes, yeah, yeah. And that's another tough one. If there's any tenderness associated with this kind of a picture, I would say you're not going to wrestle today. You better go see the doctor and get a definitive diagnosis about that. So acne can be a real problem. A couple of ringers. Pityriasis rosea. Anybody ever heard of pityriasis rosea? Pityriasis rosea is probably a viral infection, although nobody's ever isolated the virus that causes it. But it occurs generally on the trunk. It's characterized by a herald patch like this, large patch. This is probably a herald patch here. And then the lesions kind of follow the skin lines. If you look here, you see that follow that line, following that line, following that line. Here you can see it following the line, following the line, following the line. If you look at the back, and unfortunately I don't have a picture of that, some people have characterized it as looking like a Christmas tree. If a wrestler has this, they can wrestle. There's no problem with this. Teenagers get freaked out. They wake up and they notice that they've got this rash they didn't have a day or two ago, and they get freaked out. They go to the doctor, and it's pityriasis rosea.
And the reason that you wouldn't diagnose that as ringworm on the right picture is because it has more of the triangular shape to it?
No, because it has all these other lesions that follow skin lines.
Okay. It's just not isolated
It's not
and
it's not an
standalone.
isolated standalone.
Yeah.
But that athlete shows up with the note saying it's not contagious.
Right, exactly.
So the athlete will almost surely show up with this is psoriasis. Bad thing if you have it, but perfectly okay to wrestle. And psoriasis can come in what's called a spotted form or the guttate form, and that's perfectly okay. This is just a very bad case of psoriasis.
My only comment with the psoriasis is, like some of the other stuff, because the psoriasis ends up thinning the skin, that, you know, some of these areas, it's not bad to have that covered, because I have psoriasis and it's very easy to break it open, so, you know, any type of area along the way, I'd be saying, you know, it's my recommendation from experience would be to cover it.
I think that's very reasonable. You're going to see wrestlers looking at their skin, and you may be the only person who looks at their skin forever. And it's important to, if you see one of this, especially on the back or someplace where they're not looking, it's important to call their attention to it. This is a cherry angioma, not dangerous at all. You can see it's got some other satellites along with it. But it's dark and it's round and it's on the skin. But these two, this one here, notice how it's irregular, and this one down here are melanomas. And that's a fatal tumor if it's not taken care of. This is a blue dome nevus. Again, it's quite regular rather than being irregular around the edges. Any of these that you see, you really ought to tell the wrestler, hey, you know, nothing to get you from wrestling today, but I would go and see your doctor about this spot I just saw on your back and look at it. When I was at Western dealing mostly with people under the age of 21, in the 10 years I was there, I found 8 melanomas. So it does occur in that age group. Okay. Differentiating infectious from non-infectious. This is a table here. This is a good time to tell you that if you will sign up with your name and and your email address, I can send you this set of slides without any trouble. And I think that David, did we get the handout put together?
We did. We handed out the not the PowerPoint, but we handed out the skin, the doctor's skin form.
Okay.
With the instructions.
Okay. Because this is on that that PowerPoint. But the important thing is, infectious things have redness and blisters, and it looks wet and it's tender, maybe warm, etc. Non-infectious don't have those things, and that's a good help, because I can't show you enough pictures to get over everything that you can possibly see. And here is my basic guide for it. I use this guide myself, and you should too.
Doctor, quick question for you. I noticed there wasn't anything about warts, which is a communicable skin disease. I mean, is there any indication or any direction?
No, let them rest.
I had bad
Technically, warts are also caused by virus. Technically, they are contagious. They never cause anybody any significant trouble. I don't have any problem.
They're communicable, but they're not something that is a dangerous condition that's going to risk somebody's life or
exactly. Exactly. Well, we've taken more time than I was supposed to take.
One of the most common things we see on a note, it just says dermatitis. Would you comment about that as a diagnosis?
Dermatitis just means a skin inflammation.
I know.
And if you think it's infectious, they don't rest.
So red, swollen.
Good, thank you very much. Get Damon this presentation, I'll send it to everybody in the association.
Okay, I'll send the presentation to them.
So let me ask you, did the coaches actually get something like this?
Do you ever do this for coaches?
I mean, that's weird.
You know, it's interesting. Coaches used to be the most resistant people to this, and now the coaches have finally, I think, are getting religion about this, and they're calling, getting their wrestlers to physicians and things like that. It's going well.
It'd be great if you have 5 or 6 or 8 kids out, you know, one.
Yeah, at the coaches association meeting that they have, the coaches yearly thing, it'd be great if that was something that they brought you into that and do that.
If you're a new guy, make sure you know it's psoriasis and eczema, because I've had to override somebody else, some of us have psoriasis, but yeah. You don't wanna exclude somebody.
Dr. Howe, thank you again.
All right, the season starts tomorrow. Bunch of stuff to cover before the season starts tomorrow. So I'm gonna blow through a lot of stuff here. We're gonna have to cut short because that presentation took a little bit longer than we expected. The mentorship program. I mentioned this previously. We've got all the mentors and mentees assigned. Just a reminder, since the season does start tomorrow, connect with your mentor or mentee, talk with them. You know, if we can get pairs of guys to dual meet in tournaments, great. But really, the whole point of being a mentor is to be a resource. So help each other out, because there's only so many questions Bob can answer or I can answer. So there are the pairings. We've had a couple changes since I wrote this up. I think we're not sure where Leo, is that his name? Leo, if he's going to officiate, or Ephraim. So if you're a mentor and you'd rather opt out, let me know and we can rearrange some people in the next 24 hours. Hopefully it's not a surprise. All right, next. The video training program, also mentioned this. Haven't heard from anybody that they don't want to participate, so I'm going to assume that everybody is participating. If you want out, just let Damon know. Everything else is the same except the next slide. First assignments start this week. They're there. I don't know if Bob's had a chance to put them in Arbor yet, not yet. So this will be news to you guys. I got a camera here. I don't know where the other two are.
I didn't bring mine tonight, so we're gonna need to hook up with.
Yeah. Mike, you get yours?
Okay.
I'll be in.
Natalie and David, Paul, David, you good?
Say again?
Snyder's report?
So I've been slow rolling the assignments out, so we had everything covered through, assigned out through this weekend prior to now. I assigned the following week, so stuff through December 8th is out there now. I'll, in the next day or two, get the following week out. So I just sort of slow rolled it a little bit because some guys were having trouble getting through their certification stuff. The website was giving them issues or weird technical problems, etc. But at this point, you'll start seeing the rest of the assignments for December roll in now. I'll wait until later in December to do the January assignments. So give us a chance to sort of see what's happening with guys in December, especially for guys that are apprentices that are up and coming. If they're ready to start doing more advanced stuff, varsity stuff, then I'll be able to start feathering those kinds of assignments in for them. Other than that, now that we are in the season, be on Arbiter like every day, okay? Because stuff changes, guys have to drop, get replaced, etc. Because of work assignments, sickness, whatever. So stay on top of that stuff. If it's a short notice thing, I will call you. If it's like less than 48 hours, I'll give you a call. If it's more than 48 hours, the main way I'm doing this is through Arbiter, which shoves emails out to you. So stay on top of your email, stay on top of Arbiter.
Okay. All right, on to the training portion. So the rule we talked about 3 weeks ago, the new rule, changing rules that allows for falls and near falls out of bounds has caused some confusion, as expected. The state has come out with some clarifications. First of which is the heels don't count any different than the toes. So if he's on his butt, if it's on his heels like this and he's off his butt, he is out of bounds. Okay? Next.
And you have proper pinning. With pressure where it belongs.
Okay. The other confusion seems to be around the idea of the toes being supporting points for a takedown. And this has generated lots and lots of confusion. The short answer is the two are unrelated.
That's stupid.
Be that as it may, that is the rule. That is still a takedown. But if he's on his back, it's not a fall. Okay?
If he's on his back, he can't earn a near fall either.
Right.
But that's a takedown and they're out.
Yes.
Takedown out of
You don't
bounds.
get to continue there, so,
Right.
yes, that's why you can't get.
Okay?
So, but if his knees were down and in, it goes on.
Yeah.
Yeah. Then in the end.
Yeah.
And it's in.
But if his knees were in, if he's on his toes, then we're out.
If one knee goes out and one
His knees would need to be in bounds for him to still be in bounds.
Yes.
Okay.
And
Next
on,
week.
And on the map.
All right, this is the other thing, and this wasn't clear to me either, but one shoulder or scapula counts as 2 supporting points.
Okay, where does this interpretation come from?
This came from Terry.
Okay, this is wrong. I'm just gonna say it flat out. It is wrong, and there's nothing but precedent in the cases in the NFHS case manual for decades that tell you each shoulder counts as an individual supporting point. This is flat out wrong, I'm gonna tell you right now.
After you contact Terry, I'll send out a
It
correction.
is flat out wrong. Everybody in this room, that is flat out wrong.
Okay, Bob, now, you're right, there's not, but it does clearly, and this came out a couple of years ago, which is
Right.
very confusing for
It
us.
is.
The language is
It's the language of 2 supporting points is the wrong part. It does clearly state in the rules that a fall and a near fall is considered, or is to happen if one part, scapula or shoulder, is inside the boundary line. It's a live action still, and we can be, as an offensive wrestler, I can be completely off, and as long as one pinning area, the scapula or the shoulder, is in bounds of the defensive wrestler, we can still go as long as I don't touch.
So
But that's clear.
here's the clarification though,
Yeah.
and why I tell you this is flat out wrong. The case manual tells you that each shoulder is an individual supporting point. It's not, what that rule is telling you is that any part of the scapular shoulder is the complete part.
Right. It's
Not that
whole
one
thing.
counts for both of them. It just that this tip of my scapula counts for the whole shoulder. So if some piece of this is in bounds, then it's considered in bounds. But the one piece does not count for both things. And there are case situations, multiple ones that over the decades have told us this. They tell us, oh, right shoulder in, left goes beyond the boundary line, stop counting, no fall, right? Because they are 2 separate supporting points, and this interpretation is flat out wrong. Do not follow this, I'm just telling you. You will be calling it wrong if you pin a guy because he has one shoulder, in and nobody else has any other supporting points in. They're not.
But it clearly states it here in Article 2, Section A.
That language has been in the rule book for a long time.
We're not gonna solve this here.
But it makes it so you have support to say that, yes, it's okay.
But that's why you have to consider the case situations. They clearly tell you the concept.
And this is important, now this is important. My understanding is the rule book trumps the case manual.
Sure, but that's just clumsy language. The language is just trying to tell you, one little part of the shoulder counts for all of it. That's all it's trying to
The
tell you.
language is in error, because.
It's clumsy.
The 5 dash, whatever it is,
Yeah.
12 dash, 2 dash B. What the problem with the language is it does say erroneously that any part, right here, this is practically out of the book. Any part of one shoulder or scapula are considered
It says all of the supporting points.
all of the supporting points, and it shouldn't, it should just say, it should be in the singular. It's a
Okay,
problem.
we're not gonna solve this here.
I know, it's a problem.
So this is what we've been instructed though. So, Bob, I don't know if we wanna tell people not to call what we've been told to call.
I'm just telling you, I'll call Terry tonight because that is flat out wrong.
Okay?
I'll show you the case manual situations right now.
Please, I just wanna make sure that we are in line with what we've been told to do with the rest of the state of the is wrong. Maybe okay.
But
Next slide, please.
Eric, sorry
Matt's
to
got a
belabor.
question.
So if the offensive wrestler is completely out of bounds,
Yeah.
the guy who's on his back only has one shoulder or one scapula still in bounds.
You're out of bounds.
You are out of bounds.
Not per this.
What if he's on his knees?
This changed like last year, or the year before that.
It's been unchanged the last two
Yes.
years.
All I can tell you is it's discussed, it's bothersome because it does say
It is
that it
bothersome.
is live.
If we get change of direction, I will be sure to communicate that all. I was surprised to see this, that's not how I ever called it.
Yeah.
So, and you got the same email from Terry, right, David?
I did not. It looks like you got this one and I did not.
But anybody's getting that, Eric saying, don't shoot the messenger.
The question is,
But it's still.
the guy's at 45,
I know it's been a few years.
if the offensive wrestler is in bounds and the other guy is out, but one of the scapulas there to 45 and is over the line, we're counting that.
We're already counting that, that's the new rule
But
this year.
if the guy's on the other side, now no supporting point is down inside the bat. The one that's 45 degrees is above the line, he's out. But if he was down, he's in.
Yes.
That's what's strange there.
So, like I said, if you're different, I'll let you know. Okay. The one last thing you guys need to know, especially you guys, before you go out there, is the concussion protocol. This is probably, if you hear nothing else today, this is what you want to pay attention to. So, this is mandated by the WOA for all sporting events, not just wrestling. As the official, one of the 2 questions you're supposed to ask that both coaches, each coach, before the start of the event is, do you have a healthcare professional authorized in concussion management on site? And who is that person?
Introduce yourself.
Hang on. Okay? The only acceptable, it's either yes or no, okay? And they can point to the person, or at least the person will be here. And usually, if the trainer is covering multiple events, they might not be there right now, but you need to find that person before you start. If the answer is yes, then if you suspect signs and symptoms of concussion by either athlete, any athlete, you stop the match, you start injury time or recovery time, depending on what's appropriate. Get the trainer to make a determination. Okay?
Just like being in my classroom.
Okay. So, if the answer is yes, you have a resource. If the answer is no, then you have no resource, in which case, if you suspect the wrestler is showing signs and symptoms of concussion, he is done. Okay? It's very straightforward. Okay? They've tried to make this as simple as possible. I don't understand why it's taken 10 years, but did I miss anything on there? A healthcare professional from one school can attend to athletes from another school. That's permissible. It's not your responsibility to work that out, however. In football, we're told, if you're good with that, that's fine, but it's not your responsibility to facilitate that conversation. Okay? I always talk to the health trainer before the event and say, because wrestling is kind of a different animal than a football game or a basketball game where they can re-enter at some point later, so you tell them, I'll get 90 seconds. Not that they need to rush their decision, but just be mindful of the
And that's the injury or recovery time that's the.
Injury time is 90 seconds, recovery time is 2 minutes.
And that's the time that.
Right, and if they can't, if the trainer cannot clear that person in that time, then they're done. Okay? Lewis?
So, just to tag on what you said, perfect example of a messed up situation is, who's your healthcare professional, who's your concussion qualified professional, and the coach says, well, both of us coaches are trained. It's like, are you a healthcare provider? You're not? Okay, well, that you don't count. And I had a coach that tell me that they were they were trained.
They could be.
And I asked if you are a healthcare provider, healthcare professional, not just coach, healthcare professional.
Lewis, if a coach wants to take that on himself, we are in no position to challenge that. So,
Doors propped open.
you know, they've made this really simple for us, and we try to interpret it in different ways, we get ourselves in trouble. If the coach says he is a certified healthcare professional, how do I know that he is not?
And it's not your responsibility to figure that out.
Yeah, Christian, question?
You know, there's a lot of times I get really particular with the language I use, and this is one that I have a card printed up, and I read it directly to the coaches. I don't even mince words. I don't guess. I want to use the words healthcare professional trained in concussion protocol. I mean, very clearly stated. That way there's no question when a kid gets hurt and I didn't recognize it or whatever, and I have to stand in front of a litigator or a judge and say, what happened? I'm going to pull out my card and say, this is what I read to that coach, and that coach affirmed that yes, they did, or no, they didn't. And so don't put yourself in jeopardy, just print one of those cards and just read it to them.
And at the high
Because it
school
tells
level,
us
at the high
specifically.
school level especially, the coaches are very well trained in this.
Yes.
And that's why no coach that I've seen in the past 5 years would make a statement like that if he weren't qualified to do it. He's just putting his job on the line.
Not just his job,
Well, his
person,
Yeah.
it's a civil thing.
Okay. Point 2, responsibility of informing the official that a wrestler has been cleared to return lies with the head coach. We do not need to go to the trainer, okay? If the coach says the person has been cleared, you take the coach at their word. Again, especially at the high school level, no coach is gonna take that chance of going around a trainer. Okay, 3, and this is the part that I don't think we've done the past few years, and special emphasis this year. When a wrestler is removed from competition for exhibiting signs and symptoms of a concussion, whether by a healthcare professional or the official needs to fill out a concussion report on the central hub, okay? This is a big pain in the ass, especially when you're a long day of wrestling at a tournament, and you get a kid that gets taken out, you need to make a note before you forget. Before the bout sheet goes back to the head table, you need to make a note for yourself, so you can go to when you're done, you can go online and file a report. The report itself takes 15 seconds, it's just remembering to do it and having the correct information. But it's in your own interest to protect yourself.
So that's whether the wrestler returns or does not return.
No, if the wrestler returns to action, you don't have to worry about it.
Because it's not
He's
our
not
call.
been removed. If the wrestler is removed and is no longer eligible to participate, then you need to fill out that form.
Wait, to be clear, whether or not the wrestler is eligible to come back to that match, it's not the rest of the day, it's just that match, right?
No. If he is not eligible to participate in the rest of that match, if he is removed from that match.
From the match.
Or the rest of the day.
Well, then it's the rest of the day too, for that matter.
It's a 90-second.
Right. If he is not able to complete that match, you fill out that form. Whatever happens the rest of the day is irrelevant.
Okay, actually, I gotta argue this one for just a second, because this happened to us when I was still coaching at Roseville. We had a case where we're at Eastside Catholic, one of our kids got bonked on the head, at the exact same time that the trainer was already checking someone else out. We ran out of injury time because they weren't able to finish in time.
Yes.
So then they went out later and got checked out afterwards, and then they were cleared to return. But we had to forfeit that match. So it's not, if you're removed from the match, does not mean you're removed from the day.
The mechanic that I've worked with is that I will not start the injury clock until the trainer is available.
That's not what we were told at the time.
Well, at the time,
Okay.
but that's how we handle it now.
Is it?
Because you can't, you don't want to disqualify a kid because the trainer's not available. So,
Association.
Bob?
So, just to be clear though, if we see signs of a concussion, we send them off and say, okay, injury time, I see signs of a concussion, coach, you give the kid to the coach. And let's say he doesn't come back on, but not because he doesn't have a concussion, just because the coach goes, he's done, right? Like,
You don't know any different.
yeah. So the thing is, if the trainer or somebody said, he's okay to wrestle, coach, and coach goes, Max, you're done for today. Like, so whether or not, are you saying whatever reason he doesn't come back on, we have to report that, or?
I'm not gonna track down the trainer and get an explanation, so I will just take that and say, he did not return, and I'll fill out a form.
Wait a minute. If a wrestler is taken off the match for concussion protocol, okay? They spend time with the athletic trainer, all right? He or she says he has a concussion and cannot or will not return for the rest of the day. You as an official have to track that information down and report it on Central Hub that evening.
Yeah.
It has to be done. But you said you weren't gonna track it down. You have done.
No,
that's not what he was saying.
I said I would not track him down if he was not returning for reasons other than a concussion.
But my point is you gotta make sure that if he was removed, you gotta verify as an official, find out if he was or was not.
If I stop a match for signs and symptoms of a concussion and he does not return, for whatever reason, it doesn't matter to me, I'm filling out a report.
Why not? The question is, why wouldn't you?
Right.
That's what
Why
we're not supposed
Why
to.
would you? It protects you.
We're not supposed to though. Only for concussion protocol.
Right, that's why you said
Just like an injection.
Bob's example is
It's just like an
perfect.
injection for tracking.
This allows the school.
Central Hub's not gonna look at something other than a concussion protocol.
This allows the school to follow up and make sure the protocols were followed.
Concussion
correctly.
protocol.
Right. If they get an extraneous kid in there, it's better than having that kid left out.
Yes.
So, it's just too complicated for me to track down and say, okay, so was he removed? The trainer says, no, he can go, and I have to go find the coach and say, he's not coming back, why not? No, I don't have time for
Okay,
that.
so what are you gonna do if the kid's removed for concussion, and you don't track the information down, and you don't report it?
No, you're gonna report it.
You can
You
get
will
it.
report it. You're gonna report it.
That's
He
not
doesn't
what
come
we
back.
said. That's not what we said.
He said he's
That's
gonna
not
If
what
I
we
take
said.
him off for concussion, he gets reported.
I'm saying I'm
Comes
gonna
back
err on
in
the
that
side of
match.
caution. I'm not gonna take a chance if the kid is removed for reasons other than a concussion, and I don't know about.
So the sequence is, he's seen the signs of concussion, handed him over, and the kid didn't come back to return to the match.
So he's
He's
gonna
got
So
right
it's a
to report.
concussion.
Even if someone helps.
Regardless of whatever reason, he didn't come back. He just didn't come back, I sent him off, and he didn't come back.
Boom, then it's a concussion.
All right, situation.
Just so it's the second injury timeout for the kid. The kid he twisted his ankle, signs of concussion, has 10 seconds. We know it's not gonna be done. Would you ask, I mean, cause they're gonna be done with their time. You're still gonna you're gonna still fill out that form.
Yes.
So they didn't even get to even do the protocol.
Right. Because
No, that's what I want. No, that's,
have any time.
he's just asking clarification, you know.
Yeah.
I'm just saying, this protects the kids, and
Okay.
it protects us.
Okay.
Okay? This is really, and it's not a very good system, but it's an accountability system,
Yeah.
and this is the best the state has.
I just wanted to.
Makes sense.
Okay, situation. After an on-site trainer removes a wrestler from competition for exhibiting signs and symptoms of a concussion, the wrestler's father comes down from the bleachers and says he is a MDRN.
An SOB?
EMT. SOB.
That's the way people.
Donald Trump called it
Okay.
SOB.
What do? The on-site healthcare professional must be designated before the competition begins. In this case, the wrestler's father is not authorized, even
Unless
if
you're
he
one.
is a physician, to clear the athlete to
And
continue.
he is an SOB.
But what if it's O'Day?
And it's a
The
priest.
same
Tell me what he
situation,
understands.
It's a
same
priest.
situation as the point is, but instead of accepting the trainer's decision, the wrestler's father tries to pressure the trainer to change his or her
Why is the
That's an
dad even
SOB.
there?
Because the dad's
Call
come
to your
down.
coach.
So, again, the official should instruct the parent to return to the stands.
So, okay. That's a dad there.
If the parent refuses, the official should notify, yeah, we
should
get,
fight him.
you know, it happens.
It's just an SOB.
In either case, you should tell the trainer not to feel pressure from the parent to clear the kid. Okay? Next. All right. In the first round of a tournament, wrestler A bangs his head and is declared ineligible to continue by the on-site healthcare professional. The scorekeeper records the match as an injury default. 2 hours later, wrestler A hears his name called for the next round match and proceeds to wrestle that match unbeknownst to the head coach who is coaching on another mat. Who will be sued if the wrestler A is pain injury in the second match? A, the head coach. B, the official for both matches. C, the trainer. D, the tournament director. And E, the answer, all of the above.
Yeah.
Okay, so what should you do? If you have a tournament, if you're in a tournament and first round you have the kid removed, it's not sufficient to write injury default on the bout sheet and send it back in because the head table doesn't know. So what should we do?
Report to the tournament director.
Well, I think you will find the tournament director and the head official and
Should we
say
do
this
head
kid was
official and the
removed.
tournament director, right?
Yeah.
Or just.
At
And-
a minimum, the tournament director,
Yeah,
right?
even if it means stopping that match,
Yes.
okay?
And then wouldn't you write on the bout sheet, removed for concussion
Yes.
protocol,
Yes.
unable to wrestle for the balance of the
Right,
tournament?
but that's not sufficient, because the match person, the racket person may not know the concussion protocol. This is on you, man, and it's all gonna come back to you if there's a problem.
So I think one of the ways of solving a lot of this is if you have a flagrant misconduct, if you have a coach's misconduct, if you have a kid removed from injury, you take enough time, you take the bout sheet yourself. You don't let it get run back. You walk it up to the head table.
Hold on to it.
You hang on to it, you give it to the tournament director and say, you know, this kid's been out for a concussion, or this coach has a misconduct penalty against him, or a flagrant misconduct. And that way you've made that face-to-face contact, and you find the head official of your group, and you at least let him know about at least the coach along the way, and that way you've covered your.
Not to mention that many tournaments now don't even have bout sheets, right?
Yeah.
And your accident rate goes into the ether.
But the key is, what you're saying is, I would not start the next match. What we're being recommended is don't start the next match, go to the head table, go to the tournament director and make sure it's recorded that this was what happened and why.
Now, what the state is recommending for, also for misconduct and sportsmanlike penalties, is having a sheet at the head table.
Which works out well.
And when you have one of those situations, a flagrant, an unsportsmanlike, a coach's misconduct, or a suspected concussion, you go write that down on the sheet of paper so that the next official that comes up sees what's already been recorded and knows whether the coach needs to be ejected or not, or whether the kid should be wrestling. I recommend that we do that. If you're head official, I'd like you guys to start doing that for our association.
Yeah, we started doing it last year, which was really good.
Yeah, and we need to be done consistently so that from tournament to tournament, we know what to expect.
So if there's a case where someone hits their head, run out of injury time, the trainer says, hey, I wanna take some more time, take a look at them before saying whether they're out for the rest of the tournament. They forfeited the match.
Right.
No problem there. Now, how do we handle that one? Do we have, because we're not supposed to go track them down, how do we find out whether or not they were removed?
That's the coach's problem.
Okay.
Yeah.
So we don't write.
So we fill out the tournament director or whoever, but if the trainer then comes back and says he's been certified, he can come back, the tournament director would know. So at least somebody knows what's going on.
Can I ask a question?
So then you would direct the coach at that situation, hey, if he is available to wrestle in his next match because he's cleared concussion protocols, please tell the tournament director. Because otherwise, if we're reporting to a tournament director, this kid's been removed for concussion protocols, that tournament director then would flag potentially that wrestler's file and then ask for the coach to come and clarify whether or not he's able to participate.
Okay.
I know we belabor ourselves by individual comments, but I had at least 2 of them last year, and I went directly to the trainer and said, is this wrestler able to continue on with the tournament? If they said no, then I made sure that the tournament director, the bracket person, and the head coach knew that that wrestler was not to wrestle again. I was just looking at that, number one, to protect the kid, but of course, protecting myself. So, the key is, and I think Eric, you're really making good points here, the key is, we don't want the kid to get back on the mat if he or she's been deemed ineligible to continue. And I think we have a responsibility to that kid and to the sport to make sure that that kid doesn't wrestle again.
And to our spouses and children.
Yeah, right, so anyway.
All right, so we have a few minutes left. We had left off a couple meetings ago in this deck, so we'll pick it up from here. There was some confusion about weigh-ins, whether we weigh in boys and girls separately, or weigh them in together. So that's been clarified. I sent that clarification out, but we'll cover it here just real briefly. It's up to the home team coach. Okay? If he wants to weigh them in together, they'll weigh in together. If they want to weigh in them separately, we'll weigh in them separately. Okay? And then we default to where we did what we did last year, which is having an adult, preferably female, accompany us to weigh in girls if they're weighing them separately. Boys drop their straps or take off their shirt so we can do a skin check. Girls do not. It's pretty simple. Fred?
Well, I had a situation, luckily I kind of figured it out. A girl looked like a boy. And didn't have any chest or nothing.
How did you figure that out?
But I was almost was going to like drop it, and I thought, no, this is actually a girl, so I didn't say nothing. But it came to my mind, but some, they could, nobody was there to tell me nothing.
I just had it, and the word at the enactment at the conference was that there in the Everything Association, there's a transgender kid.
Okay, this had to be a transgender.
It doesn't matter.
Let the coach.
But nobody told me anything.
This
I just
is
kind of figured it out.
designed so that we don't have to be in those situations, okay?
Okay, it'd be nice, but nobody, but then I kind of figured it out. But,
Fred, just go on a limb, sometimes you can wait, and you'll be okay.
Clarification, if the home coach decides they want to do both ways in one room, okay? But the girls are going to have a separate match, meaning they're going to use their own weights. How are you going to handle the weigh-in as far as order?
I don't think I've ever had that happen.
Can you explain that again?
That's you're describing two different events
needs.
now.
Yeah.
Two
That's
different
why I
needs.
bring the point up.
Yeah.
That's
Right,
why I bring
okay,
the point
that's
up.
why I'll make sure.
Common sense.
I think you do two separate ways.
Two separate ways,
Two separate
exactly.
ways.
Two separate meets, two separate weigh-ins.
Different weight classes.
The one nuance is that if they're going to weigh them in together, they can't use either of the locker rooms, right?
Right, that's correct.
But it has to be treated as two separate weights and two, because it's separate events.
If
In
it's,
your instance, yes.
yeah, if it's a girls' meet and a boys' meet at the same place, at the same time.
So if they're gonna weigh in the boys and girls together, and it's the same weight classes, obviously.
Right.
It needs to be in a non-locker room setting.
Like an ox gym or something.
Yeah.
Auxiliary gym or whatever.
Wrestling
Right,
rooms.
right,
something
right,
like that.
okay.
Always.
That's the only way we will let that happen.
And if any part of one shoulder is that counts as shoulder to shoulder.
But toes don't count.
Why isn't
There's
that-
a lot of it- toes.
Sorry?
Just to clarify, and finish with that point there, is just remember that if they're gonna use it at different, at an auxiliary gym, boys can't strip down in that gym. while the girls
Right.
are in
Well, they just drop their straps.
there. No, that's what I'm saying, I said, they can't get
They
dressed
can't
in
get
that gym. They
dressed,
gotta use
right.
the locker
Come in
room.
and they're.
Yeah, yeah.
Oh,
Right,
right.
to get ready for the
Good
match.
point.
Question on, they now weigh in their uniform, right?
Yes.
Does that mean shoes, pads?
No.
No.
Just singlet or uniform?
Boys have uniform.
Singlet or shorts for the guys, right, wrestling shorts.
So what you're saying for using the auxiliary gym for both boys and girls, the boys have to enter the gym with the straps down already.
No, what I'm saying is they have to dress in a, same with the girls.
Get their
So
uniform
right now,
on in
dress
the locker room.
regular locker
In a
room.
weigh-in, oftentimes you'll have, especially if a tournament, you'll have the guys come in
And
and
they're
in the
dressed-
street clothes.
yeah, street clothes.
And they'll strip down and change into their singlet before getting on the scale.
With girls
Ray's
present.
point is that if there are girls present, they can't do that. Chris?
It is common sense.
So if, say someone's wearing in the shorts and the compression top, would you have them take off the compression top for the skin check?
Yes. If they're a boy,
Alright.
Yes.
not a girl.
Okay.
Questions?
Unless your name's Pat.
Or Jody, or Chris.
Does that apply to like JV tournaments as well?
Saturday Night Live. Okay. Yeah, Saturday Night Live.
And again, the
I'm
shorts,
asking Chris.
for the weigh-in with the shorts, it needs to be a school-issued shorts, right?
So
Yes,
last
their
thing,
uniform. They have
Part
to
of
be
the
uniform,
uniform, right.
their uniform, competition uniform.
Right.
so I asked Ray to prepare, last meeting, but we never got a chance to get to it, about how he does his pre-meets. So if you would give us,
Actually, you guys already went through it. Last meeting you guys did it pretty much right,
okay,
right on.
so for the reinforcement for the new guys, can we do it again?
It's a, so we're talking weigh-in?
Weigh in and then pre-meet.
Okay, so as far as what I do is pretty much what Eric and these guys have already gone through, so I'll just real quickly, what I do is, head official for varsity national, this coming Wednesday, I'm gonna walk into Kentwood High School against Rogers. Is I'll find my head coach. They all know who I am, but I'll introduce myself. As soon as I find him, hi coach, how are you? Do we have a healthcare provider tonight? It's the first question I ask when I meet him. They said, yeah, we got one here, great. Usually it's gonna be the trainer. I'll introduce my trainer once we get out in the gym. They say, hey, anything's blood, anything, concussion protocol, it's all gonna come to you. Perfect, I don't have to do anything. So as weigh-in, I line my two schools up, go through, first thing I go through is,
You've already picked the order.
yeah, excuse me, thanks, man. Yeah, that's the first thing we gotta do, is we gotta pick orders. I'll establish my weight lines that way. And then, at that point, once we've established our weight lines, I find my captains, have them raise their hands. And then I inform my captains, it's your responsibility to keep your wrestlers quiet for me, so the coaches can hear any conversations we're having about check-ins for weights. And then at the same time, then I will go over, medical notes. Please, if you have a medical note, bring it up with you, okay? Present it to me before you step on the scale. At the same time, if you are wearing a hairnet, it must be on your head. Before you step, I want to see it covered over your head. And then once you establish that, you take it off before you step on the scales. reminder that no jewelry can be worn anywhere, no bracelets on your ankles, here, anywhere, it's all got taken off before you step on. And then, I had this all written down a couple weeks ago when we did this.
Braces, not guard.
Thank you, that's exactly where I was going. Remember, some of these kids are wearing these new braces. Both top and bottom have to be covered. If it's just the top, it's just the top. If it's both, it's just the bottom, it's the bottom. Okay, as long as it's protected. All right, they just bring it up, smile, see what it is, I verify it, if you've got top or bottom or whatever it is, and we're done at that point. All right, then I tell them, so special equipment, braces, any of that, bring it up also, we'll check at the same time, we get that over with. And then, as far as, when you get ready to step on the scale, I tell them this. I says, I'm gonna ask you to step on the scale, verify the weight, step off, and then I'm gonna have your hands out like this. Just nails up. So what I do is I just grab and pull. If I can feel any of them, I tell them to cut them. No big deal. Then, of course, I'm checking hair at the same time, shave, whatever. Ask them to spin, we're good, they walk off. Real simple, okay? When we're all done, you sign your weight sheets for both schools. If you've got any shaves or nails, I put the responsibility on the coach. Coach, he or she needs to check back with me before you come out to wrestle. If they don't, we all know the protocol. If a kid comes out and unshaven, well, it's going to be pretty difficult to get it done. You now have a technical violation, you have a minute and a half to get shaven. If you don't, you're done. Real simple. Same thing with braces. Okay, if he comes out, you give him ample time to go get his braces, 1.5. One thing we will not do, and please don't ever do it, do not let wrestlers share covers for their mouths. I don't do it. I won't allow it to happen. It's just because there's just... Well, all I care is to get back and back for doing hats. That's all that matters.
Yeah, again,
So they're
I agree.
ready to wrestle. So at
Wants
that
to borrow
point, I pretty much got everything done.
I don't care where it came from.
As far as pre-meet, I make it real simple. I bring the kids together. First question I ask, Coach, are they ready to wrestle? That means shoes are secured. Okay. Last year's new rule, that it has to be all the way around the top of the ankle. No longer is if the shoe laces are double knotted. They used to just roll the tape around it. It's got to be all the way around the tape. Bobby, is that correct?
Well, it has to be,
Unless it has a
taped to the
mechanical
shoe.
device.
Taped to the
It
left
could
arm
go
side.
around this way
Either
or
way,
that way, whatever.
as long as everything's covered up.
Yeah, the lace has to be attached to the
That's
shoe.
if it doesn't have a mechanical
That
facet
is correct.
as a part of the shoe.
Correct. So, once I ask that question, that tells me as an official that now the coach is taking the responsibility of his kids are ready to go. Meaning, shaven, nails, headgear, freestyles, shoes are all taken care of. Okay? I also remind him at the same time that all that has to be snapped on, shoulders up, if you're wearing a freestyle, before you walk on the scale, walk up to the table and check in. Don't let them walk on with hit one off. Don't let that happen. I know that'll be the big discussion at the tournaments. Well, what's the wrestling area, what's not the wrestling area? Okay? I go over a couple small things. My verbal commands I go over, what the wrestlers will hear from me. Stopping the matches. When I bring them back to the center of the matches, what they're going to hear from me. During the wrestling, I'll tell the wrestlers that move back towards the center. All right. I don't give them a lot of individual commands. I try to make it where they realize I'm talking to both of them. Okay. We need to improve, gentlemen. We need to improve, wrestlers. That way they both know I'm talking to them. I go over stalling. What do I expect from them? You know. Then as far as good sportsmanship, stalling, and wrestling the edge of the mat. I said, if you have two options, you can run them off or bring them back. I tell the offensive wrestler, make an attempt to bring them back towards the middle. Or I may call you for fleeing or at the edge of the match. Pretty much that simple. I don't think I missed much, did I?
Since we have a minute left.
Yeah.
Can you give us your spiel to the head coaches during the coaches meeting for a tournament?
Real simple. The biggest thing for head officials is remind the coaches that they have that 5-foot line on the mat. And if they're not there, ask your athletic director or your tournament director to put them there. It helps us all as officials. The one thing that I do tell my coaches, and I should have brought up earlier, is this, Coach. You are more than welcome to come to the table and talk to me. I say, that's your right. But with that said, if you're questioned by judgment at all, Coach, we now have a problem. It's that simple. I very seldom, I honestly cannot tell you, last time a coach came up to my table and questioned a call that I made. But they know they're gonna get dinged by rule. And guys, do it. Don't let them talk. Give them a warning. Because the next time it's gonna cost them. When we get later in the year, you see all these conversations at the tables. And everybody's kind of cowering and walking away without, well, you should have given a warning. It's a point of emphasis, especially at State of Need. Go ahead, Bobby.
One thing I've gotten in the habit of telling the coaches at the coaches meeting is, I say, you know, our crew cares about the safety of your kids. We're all here for the same. We're on the same team. Like, I start there. We're on the same team. All right. Okay. Now, because I want to remind them, like, let's not be adversaries. We're like, we all want the same thing. Like, so let's start there.
Just to finish there, and one of the other things we go is we try to, at all possible, is try to not start a match without a coach in the corner. You know, it's just something we try not to do. I know there's sometimes that, you know, some of these schools are here with one coach and they got, you know, 15, 16 kids, and sometimes it's tough. But what it does also, it holds up the tournament. And then we get farther behind. Go ahead, Paul.
Yeah, one other thing is I always remind them to have 2 coaches in the corner. And, you know, sometimes you'll let a scorekeeper be in there as well. You know, I don't have a huge problem with that. But when particularly these tournaments we're starting with right now, let's keep it at 2, because if you start now letting extra guys come in there, now we're gonna have some problems. Just tell them
That's
2
a
guys.
great point, but what happens later in the year, so you guys will all know it's going to happen, is once you get to regionals and the state tournament, at the state allocation tournaments, they allow 3 when it comes to the finals.
Yeah.
Just let it go. Don't even argue the point, just let it go. Because nobody's gonna change your, you know, we're not gonna change their mind.
Ray, if you got a guy who says, I'm a coach, but he's wearing wrestling shoes, what do you do?
It's not on me. I mean, if he's a coach, he's a coach. It's
Not a
freestyle.
If he's a
kid,
student, my point is if he's a student.
I don't let go.
No.
I don't let go.
Neither do
I wait.
Yeah, what you can do is sometimes the coach will come into the middle and he'll kind of look at 2 mats at the same time. And just so long as the coach gives you, yeah, I got you, I got
Eye
you.
contact,
Yep, exactly. Then you're cool. Yeah.
This kind of thing, just like this. Like, you got him. Okay.
Boom. Exactly. That's all you need to do.
Yep.
Next meeting, 2 weeks from tonight, same place. All right, good luck this week.
Yeah. And remember, the other thing is, for those that have exhibition matches, make sure to text or email me what the count of the exhibition matches are when you're done with the event that night. Tournament guys, report when the wrestling ended, and whether or not any of you guys left early.
What are we doing with cameras?
Chair up on the table. Put them back up on the table.
One camera right here. Whoever gets there first.
Hey, Chuck.
You don't have to do the chairs, leave the chairs down, they'll be.
Yeah, they said 4 o'clock weigh-in, so I don't know what the schedule is beyond that.
Who's
Jamboree.
Who's at Edmonds Woodway? Saturday. Edmonds Woodway Saturday.
It can be a tournament, because they're not doing the whole week. But I don't know how they're running.
Anybody want a black and white?
I don't know if they're doing one team versus the other, they're just saying, okay, these 2 guys over there, these 2 guys over there. Because the jamboree that. Jamboree I did before, they just sent in guys randomly to mats.